You're watching this video because something's not working in your practice, and Staffingly is here to fix it. Over 300 providers across North America trust us. We've helped them save over $14 million in staffing costs while improving patient satisfaction to 95%. You handle the patient care, we handle everything else. Let me show you. So let's be honest, this is what's happening in almost every clinic today. Your front desk is juggling everything: calls, check-ins, verifications, referrals, messages, and charting. They're not lazy, they're overloaded. So when they say, "Doctor's office, please hold," they mean it, but the patient doesn't know that. They just know that they've been on hold for too long. They hang up, then they call back. Now your call volume doubles and your reputation takes a hit. It all ends up online. You're not losing patients because of your care, you're losing them because they can't reach you. And while that's happening, your staff is buried under insurance verifications, faxes, and prior authorizations. Appointments get delayed, claims get denied, everyone's frustrated, but you didn't go to medical school to chase insurance companies or manage hold times. But that is what most providers are forced to do, and that is why we exist. We're Staffingly Inc., a US-based healthcare outsourcing company headquartered in New Jersey. Our founders come from healthcare, IT, and AI backgrounds with over 30 years of combined experience in outsourcing and operations. Today, we support more than 300 healthcare providers across North America, from clinics and pharmacies to surgical centers and specialty practices. So here's what makes us different. We only hire professionals with medical backgrounds: doctors, nurses, pharmacists, dentists, and certified medical coders. So what that means is your patients are speaking to people who understand medical terminology, insurance logic, and compliance. They speak fluent, accent-neutral English, and we also have bilingual Spanish-speaking support available whenever needed. We integrate seamlessly with your existing systems: Epic, Athena Health, eClinicalWorks, Cario, Cerner, NextGen, and over 50 other platforms. We are fully HIPAA compliant, SOC 2 Type 2 certified, and ISO 27001 secured. Every workstation runs on encrypted virtual machines, so we carry $5 million in liability coverage and have had 0 data breaches in over 8 years. So why are more clinics switching to this model? Because the old way doesn't work anymore. Reimbursements are shrinking, documentation is increasing, hiring is harder, turnover is brutal, 30 to 50% every year. Now, let's do the math. A local staff member costs over $79,000 per year after taxes, benefits, and training. A Staffingly virtual medical assistant costs about $20,000 per year, fully trained, fully managed, and fully dedicated to your practice. That's up to 70% in savings without sacrificing quality or control. And this isn't a call center. There's no rotation, no strangers, and no thick accents. You get one dedicated person who works exclusively for you, trained on your systems, familiar with your patients, and supported by a full backup team. Now, behind them is a trained backup. Above them is a team lead and quality manager. Every account has a client success manager who stays in touch with your office daily. It's reliable, it's scalable, it's proven. That's why more than 300 providers already trust Staffingly to keep their operations running so they can focus on what truly matters: patient care. See the link in the description below. So if you haven't booked a meeting yet, go to staffingly.com to schedule your discovery call or call 800-489-5877. You can also email support@staffingly.com for more information. So book your discovery call today. You handle patient care, we handle everything else. So now that you've seen how most clinics struggle with administrative overload, let's talk about how real clients are solving it. It all starts with your front desk, or in our case, your virtual medical assistant. You know what most patients complain about online? Not their doctor, not the treatments, it's the office experience. Reddit threads are full of frustrated posts like this: "I've been calling my doctor's office for a week. No pickup. They need a real person answering the phone, not hold music." And those reviews don't just sting, they really drive patients away. But your front desk isn't the problem, they're just overwhelmed. And that's where virtual medical assistants change everything. A Staffingly virtual medical assistant works exactly like an in-office team member, answering calls, scheduling appointments, managing patient intakes, verifying insurance, following up on labs or refills, and updating records inside your EMR. No scripts, no bots. Every every assistant is clinically trained in U.S. healthcare workflows, patient communication, and compliance. They're dedicated exclusively to your practice, so they don't have any rotation, no shared staff, no strangers. They learn your systems, your patients, and your protocols. And within weeks, they blend seamlessly into your operation, the voice your patients trust, the support your team depends on. Practices that add virtual medical assistants see up to 70% fewer missed calls, faster response times, and higher ratings. They can also handle pre-visit workflows, checking eligibility, sending reminders, and routing urgent calls so your local team can focus entirely on patient care. Hiring locally can cost up to 3 times more once you add salary, benefits, and training, but with Staffingly, clinics typically save up to 70% while gaining reliability, coverage, and compliance. So you get a skilled healthcare professional who feels like part of your team without the burnout, turnover, or overhead. See the link in the description below. If you haven't booked your meeting yet, go to staffingly.com to schedule a discovery call or call 800-489-5877. You can also send an email to support@staffingly.com to learn more. Book your discovery call today. You handle patient care, we handle everything else. Once calls are covered and scheduling runs smoothly, the next critical step is ensuring every patient insurance is verified before they ever walk through your door. And that's where our insurance eligibility verification team steps in. If you've ever had a patient show up only to find out their insurance isn't active, you already know how painful this can be. A simple eligibility check missed, and suddenly your scheduling, billing, and patient trust take a hit. Reddit threads are full of stories from frustrated patients. My appointment was canceled because they said my insurance wasn't active, even though it was. Why didn't they check this before wasting my time? These moments hurt your reputation more than you realize, and they're not just billing mistakes, they're patient experience failures. At Staffingly, our insurance eligibility verification specialists prevent that from happening. They check every patient coverage before the visit, confirming plan details, copays, deductibles, and authorizations using payer portals like Availity, Navinet, and Change Healthcare. So we don't rely on generic clearinghouse data. Our team logs directly into payer systems and validates each field. So if something's off, your practice knows before the patient arrives, not at the checkout desk. Every verification is documented right inside your EMR with copay and deductible details, so your billing and front desk staff always have accurate information. Practices that verify insurance up front reduce denials by as much as 50%. So when eligibility is accurate, billing flows faster and patients stop getting surprise letters. And this isn't just about accuracy, this is about trust. Patients notice when your office is organized and communicates clearly. By outsourcing eligibility verification to Staffingly, you cut errors, reduce stress, and save up to 70% in costs. See the link in the description below. Visit staffingly.com to schedule your discovery call or call 800-489-5877 or email support@staffingly.com for more details. So book your discovery call today. You handle patient care, we handle everything else. Even when eligibility is checked and everything looks clear, there's still one massive roadblock that slows clinics down: prior authorization. They're the #1 cause of delayed treatments, denied claims, and exhausted staff. So let's talk about how we fix that. If you've ever spent an hour on hold with an insurance company only to fax the same form twice, you know the pain. I lose hours every week chasing prior auths. It feels like insurance companies exist just to wear us down. You shouldn't need a degree in persistence to get your patients approved for care. Every delay doesn't just cost time, it costs trust. Patients start calling daily asking, hey, did insurance approve it yet? And your staff is stuck juggling phone trees and follow-ups instead of helping patients. At Staffingly, we built our entire company around fixing this problem. Our prior authorization specialists manage every step from submission to approval. They handle medications, imaging, procedures, and consultations. Each request is documented in your EMR. Our team calls payers, checks portals, attaches notes, and tracks every case until it's approved. We also communicate directly with your team, updating statuses and escalating when needed, so you always know where every authorization stands. Our clients see approval times drop from 2 to 3 weeks to as little as 48 to 72 hours. So what that means is faster treatment starts, happier patients, and fewer cancellations. And when approvals are faster, your revenue flow improves, fewer denials, and less wasted time. Our specialists aren't just trained in policies, they come from healthcare. So most of them are pharmacists, nurses, or physicians trained overseas, so they know what's urgent and communicate with empathy. And yes, our team speaks fluent accent-neutral English with bilingual Spanish speakers available as well. Traditional in-house prior auth teams can cost thousands per month and still struggle with overflow. So with Staffingly, you can scale instantly and you can save up to 70% in costs while staying fully compliant. See a link in the description below. Visit staffingly.com to book your discovery call or call at 800-489-5877, or you can email us at support@staffingly.com. Once approvals come in, accuracy matters more than ever. Our certified coders handle CPT and ICD coding to keep your claims compliant and error-free. Let's talk about the backbone of billing, coding, because even a perfect claim will get denied if the code is wrong. I lost thousands last month from one CPT mistake. The insurance audit nearly gave me a heart attack. Staffingly certified medical coders handle CPT, ICD-10, HCPCS, and modifier level reviews for every claim, ensuring complete accuracy before submission. We review provider notes, cross-check payer rules, and keep your EMR coding compliant with the latest updates. Our coders specialize in pain, ortho, OBGYN, behavioral health, and family medicine. Every 1% improvement in coding accuracy can boost net revenue by 5%. So our coders don't just code, they protect your reimbursements, reduce audit risks, and ensure documentation compliance. We follow payer-specific guidelines, keep modifiers consistent, and make sure that there's no undercoding or overbilling that triggers red flags. Their coders caught errors our EHR audit missed, saved us $30,000. And hiring certified coders in-house is expensive and turnover is constant. But with Staffingly, you get accuracy-driven coding at a fraction of the cost without losing control of your data. Accurate coding lays the foundation for faster reimbursements. Next, our revenue cycle team takes over to turn clean claims into clean payments. You've seen it before, clean visits, perfect documentation, and still months later, half your claims are unpaid. We submitted everything. Why is this still pending? Why did insurance deny this again? Every day, practices lose money, not because of bad medicine, but because of broken billing workflows. Our revenue cycle management team handles your billing from start to finish, accurately, consistently, and fast. Every claim is scrubbed, coded, submitted, and followed up until it's paid. We handle posting, A/R calling, denial management, and billing audits, all while keeping your EMR and clearinghouse perfectly synced. We specialize in everything from outpatient billing and surgery centers to telemedicine and specialty practices. Our certified coders ensure every CPT and ICD code is correct the first time, no rejections, no resubmits, no wasted time. With Staffingly's RCM team, practices reduce denials by up to 80% and improve collection speed by 35% or more. We used to wait 45 days for payments. Now it's down to 12. We don't just bill, we audit, track trends, and prevent errors before they start. You'll receive weekly and monthly RCM performance reports so that you always know where your revenue stands. Our RCM specialists aren't just data processors, they're healthcare professionals who understand the why behind every claim. Most come from medical and pharmacy backgrounds, so they recognize clinical logic when coding and auditing. And because we work with your EMR, Athena, eClinicalWorks, K-Rio, or Epic, you never lose control of your data. Everything we do happens inside a HIPAA, SOC 2 Type 2, ISO 27001 certified environment, with full audit logs and no personal device access. A full-time in-house biller costs over $70,000 a year, not counting turnover and retraining. With Staffingly, you save up to 70% in costs while gaining an entire team that never calls out, never misses a deadline, and never lets revenue slip through the cracks. So if your claims are stuck, your payments are slow, or you're just tired of chasing insurance companies, it's time to simplify your revenue cycle. Visit staffingly.com to book a discovery call or reach us at 800-489-5877 or support@staffingly.com. Because at Staffingly, you handle patient care, we handle everything else.